Hello, my name is Joseph Clems, and I have a father of four. I'm a husband to an amazing wife. I'm an adventurer and hobby farmer. I'm a CEO and founder of Real Life Counseling located in Vancouver, Washington. I'm a licensed clinical social worker. I'm also an addict in recovery and trauma survivor. Today, I want to talk about what is PTSD and what is trauma. A very casual, but I would say a more real definition from my clients and from my life. PTSD is wearing a mask, hoping people don't notice your hurt, your fear, or your anger. PTSD can be a belief that you are hopeless, worthless, broken, or I deserved what happened to me. PTSD can be a critic chasing perfection, trying to be good enough. PTSD can be preparing for the worst and never believing in the best. PTSD can be lost in the never-ending chase to feel better, lost in addictions such as sex, food, drugs, alcohol, or perfection. PTSD is the crushing weight of fear, anxiety, depression. PTSD can be what keeps you from finding joy, peace, freedom, and intimacy. PTSD is being alone. PTSD is being always vigilant. No one will ever hurt me. Now, that's a pretty casual definition, but like I said, I think a very real definition. The American Psychological Association, also known as the APA, offers a more formal definition, and they define trauma as an emotional response to a terrible event like an accident, rape, or natural disaster. A traumatized person can feel overwhelmed, helpless, in shock, difficulty processing their experiences, difficulty coping with anxiety, depression, grief, and may have physical symptoms. So let's talk about four different types of trauma. These four different types of trauma are acute trauma, chronic trauma, complex trauma, secondary or vicarious trauma. Acute trauma, this results from a single stress or a dangerous event. Chronic trauma, this results from repeated and prolonged exposure to highly stressful events, and examples can include cases of child abuse, bullying, or domestic violence. Complex trauma, this results from exposure to multiple traumatic events. And secondary or vicarious trauma, a person develops trauma symptoms from close contact with someone who has experienced a traumatic event. When symptoms of trauma continue or grow in severity, this can result in a mental health condition known as PTSD or post-traumatic stress syndrome. A PTSD diagnosis is reached by using specific criteria from the DSM-5, a book that is used by mental health professionals to identify this disorder within their clients. So what is PTSD? The symptoms of trauma range from mild to severe. Many factors determine how a traumatic event affects a person, but let's talk about three, right? Presence of other mental health conditions, previous exposure to traumatic events, background and approach to handling emotion. Now, some of the symptoms include with PTSD are denial, anger, fear, sadness, shame, confusion, anxiety, depression, numbness, guilt, hopelessness, irritability, difficulty concentrating. They may have emotional outbursts and find it difficult to cope or withdraw from others. They may have flashbacks, which is when a person relives the traumatic event in their mind. There's also physical responses. Trauma can cause physical symptoms such as headaches, digestive symptoms, fatigue, racing heart, sweating, feeling jumpy. Sometimes a person will also experience hyperarousal. That's a word, right? Where someone feels as though they are in a constant state of alertness. Individuals may also go on to develop other mental health issues such as ADHD, depression, anxiety, and substance abuse. In future segments, right, I hope to show how EMDR, which is a model of therapy called eye movement desensitization and reprocessing, can cure acute trauma and lead to remission in the symptoms related to chronic, complex, and secondary trauma. Just a couple quick facts about EMDR. EMDR is recognized as an effective treatment for PTSD by the U.S. Department of Veterans Affairs and the World Health Organization. So does it work, right? Over 30 randomized controlled trials support the use of EMDR therapy with a wide range of trauma presentations. It's kind of a tricky little phrase, but what they're talking about is these different types of presentations are acute, chronic, complex, and secondary trauma. Okay. So typically the equivalent of 3 to 90-minute sessions produces 85 to 90% remission of PTSD with single trauma. 12 or more sessions needed for victims of multiple traumas, such as combat veterans. All right. EMDR compared to Prozac, which is a medication, right, demonstrates that EMDR therapy is superior. Patients continue to improve beyond termination of treatment, while many Prozac patients become symptomatic again. So in closing, a friend of mine, a really close friend, told me this. He says that people are often asking these questions before they really realize that they need some help. Why does this keep happening to me? How did I end up here again? Why do I keep making these hurtful choices? Why do I keep behaving in these hurtful ways? Why does happiness and contentment continue to invade me? If these questions sound familiar to you, then my hope, my prayer is that you find a therapist that can find answers. Thank you for watching. Please send me any questions, comment on this video, and I look forward to seeing you in the future.